Therapist Thrival Guide. My name is Miranda. I'm a licensed clinical social worker. I'm here with Jessie. Jessie, can you go ahead and introduce yourself?
Sure. I'm Jessie Colter. I am a licensed independent clinical social worker as well. Work with birth to 5 families all the way up to grandmas and grandpas.
Amazing. And where are you located at?
So I'm in the Grand Rapids, Minnesota clinic. So way up north, I think, for this north location.
Yes. And today we're going to talk about parent coaching, working with parents in the therapeutic process. And I am really excited about this topic. We kind of came to it a roundabout way because you are trained in a couple of different really cool modalities. Would you mind sharing a little bit about what you are trained in and where you kind of like
Yeah.
work from?
Yeah. So I was one of those humans that wanted to take all the trainings and do it all at once. And looking back, maybe wasn't wise, but all trauma modalities. So kiddo specific, CPP, I'm a rostered clinician, and that's child parent psychotherapy. And it's a very protocol manualized modality that involves caregiver, whoever it is that is taking care of the child, the actual child. And the third client in the room is the relationship. So really you're working relational. The other one I'm trained in is TFCBT. And the version of which I've learned since there's multiple is really just young children. So it's from I want to say perfect ages like 8 to 16. Um, I'm also trained in EMDR level 1 and 2 with adults mostly. I have used it with kids, but I've almost completely quit. I have completely quit using it in lieu of. I'm now master's level trained in ART, which is accelerated resolution therapy, based on the same science as EMDR, using eye movements. But it's just much gentler. It's faster, easier to use with littles up to grandmas and grandpas. So, and I use CPP is very specific. You actually acquire a family and you work with them from beginning to end. And that can be anywhere from 12 months to my longest case was about 20 months. And so I don't currently have a CPP family. TFCBT, I can use when and where I have a client that comes in and presents with something that would fit. But and the other two are EMDR is very specific. Again, I'm not really using it. ART is on the spot. Like I can be in the midst of a regular talk therapy session and see that's something we can do. Yeah. So I'll jump in. But other times it's intentional and we schedule and the session is just that. But I would say with most of the modalities that I'm trained in, I'm not a purist. And so like I grab little bits and pieces of each and intertwine them with all ages. I think that is the benefit to being trained in multiple different ways of being. But yeah, I definitely have my favorites if that wasn't apparent.
No, I love that. And I I'm so excited to talk more about kind of what it's like to do psychotherapy with kids and involving
Mhm.
parents because I think that when I first started therapy, when I first started being a therapist, I mostly saw kids. And I think that I didn't have kids myself. And so I think I was really
Yeah.
intimidated by parents. And I think that I had this, I don't know, I had this view of like, I just want to work with the kid and I want to kind of provide updates with the parents occasionally, but I don't want to have a lot of communication with the parents. And I think part of that was, feeling like I was a little bit intimidated, but also feeling like I, was still learning how to be a therapist myself. And I think I also had some really tough cases. And so I think that some of the cases that I had were like really, really in the weeds custody cases or child protection was involved or,
Mhm.
fill in the blank. And so I think for that reason too, I was I was coming out of the child protection realm when I became a therapist. And I think that I had this fear of being subpoenaed or a fear of like saying the wrong thing to parents or
Mhm.
yeah. And so I think because of that, like for the first probably year or so that I was a therapist with kids, I tried to really distance myself from parents. And I
Mhm.
say this now being completely opposite, where it's like if I'm working with kids nowadays, I'm talking to their parents constantly. I love being in, bringing them into session or being able to, have email exchanges and talk through kind of like, what do you see? What's happening? Here are some of my suggestions. And I have found that to be so much more beneficial. I'm getting feedback, they're getting feedback, because it's so hard to work with only one member of a family and then like
Yes.
not really involve the other members. And so
Mhm.
that's kind of where I'm coming from. And so I think selfishly, I'm really excited about this conversation too, and seeing how you approach parent work and how you can. I think that for some parents, when they put kids in therapy, they're like, "Go fix my kid." But there is some like parent coaching that should be happening behind the scenes too. So, what
Yeah.
is your kind of approach to working with parents, Jessie?
Sure, sure. So I, and it's not popular opinion, I'll say that right up front, is that I absolutely require, in some cases, parent involvement. With my littles, I mean, I would say up until about 6 years old, I do require, and I use that gently because there could be situations where it's not a requirement, but I require the parent to be present in session throughout the entire session. Sometimes depending on like developmental need or level or behavioral need, whatever the situation might be, even up until I've had 8-year-olds, that still I request that the parent be present throughout the session because I get to meet with them if I'm lucky and if they're regular and they show up every single week, 53 minutes out of the week, right? And so this is just dependent upon their mood, if they're tired, if they've eaten, level of engagement. Are they going to take what we've worked on and do anything with it? As opposed to when there's a parent here, assuming they're a green or yellow light parent that are here for the right reasons and they want to support, which most are, um, they can help that process, right? Outside of the room. So I do require it. Above and beyond that, I have very regular parent engagement. So even if it's a client where the parent doesn't come in, I still will ask at minimum on a quarterly basis to have a parent only session. Um, because I think it's super important for all the same reasons you just said, to get their perspective, like what's going on, not just the bad stuff, like the struggle stuff, but also what's the good stuff that's going on. It's an indicator of what the home environment is like. There's a lot of things that parents will talk about that a kid is just oblivious to, but yet it impacts them. There's questions that, that a parent's better able to answer than a kid can. So yeah, I think it's really, really important. And in between that, I think there's still those regular weekly check-ins, whether or not the parent is in here, check in. Either they come in at the end of session for the last 5 minutes, or I go up as we're leaving and kind of give them a little update or some things that we're working on and what I've asked in the coming week. And I think those are the client that when you get that buy-in, that engagement, it's no different than our adult clients. Like they're part of this process. They're showing up. They want to be a part of it. They want to support. And I think that's where success comes, when you get the buy-in from perfect world kid too, but kid and the parent.
Mm-hmm.
Yeah. Mhm.
Okay. Do you ever feel like a parent is judging you in session, thinking like, what are you doing? Why are you playing Uno with them? I use that as an example because I
Oh,
feel like
for
that
sure.
kind of gets like thrown around as a joke. But
For
like,
sure.
I think that was one of my fears when I first started, and bringing parents in and feeling like they're just gonna question why are you what therapeutic value does this have?
Yeah. Yeah. And that can come up no matter what age, no matter what you're doing or what you're talking about. It could be the thing you're doing or why in the world would you be talking, right? So I think it's just, again, that relationship, it all boils down to connection with them. And so helping them understand, well, it's not about the Uno. And that wasn't all we were doing. It's about creating a connection where this kiddo feels safe to be here with me to talk about the things. And through play is how, not just, I mean, I think social media has really opened a lot of parents' eyes to the benefits of play. Like, this is literally how kids learn and grow, is through play. But even above and beyond that, um, it's that idea of you're safe, you're comfortable, you're playing a game, like you're in a delighted space, hopefully. They're not losing it, because and so that's where opportunity comes, like when the frustration, right? Like if they're not winning at Uno, right? That's an in for me to come in and to support them in regulation or using their coping skills or like emotion identification or even somatic awareness, what's going on. And so there's so many different ways that play is valuable. And even if we weren't, just that idea of creating connection in relationships. So if when they're ready to like start talking, because it's not all about the words. Yeah. Yeah,
So,
parents
and
do judge for sure because they don't
well, yeah,
that's
I mean, so then in that example, like let's say you're playing a game with a kid or, like you're doing any sort of intervention. How are you involving the parent? Are they just like sitting on your couch watching you do it, or are they like joining in the game? Are you kind of coaching them and and being like, "Hey mom, why don't you help him do this?" Or I mean, what does this look like?
Yeah. No, good question. So that's kind of where how I said I'm not a purist and I pull in from a lot of different modalities. And so that's really a part of that child parent psychotherapy where in that realm, I cannot be we have all these catchphrases, but like I can't be the shiny thing in the room. So I in a perfect world, I'm almost invisible and they're playing. And that is what that modality is they're playing and I'm supporting that relationship. But in general, to answer your question, yeah, I mean, we might be playing Uno, we might be playing a board game, or we might be talking, or we might be watching a YouTube video and then trying to discern, like, what did you take away from that? But they're absolutely involved in it. They're not just sitting there watching us because that would then be, those would be the parents that are not green or yellow light parents. They're the ones that don't want in the room. But if they're here, the assumption is that they're very actively involved. I'm supporting them if, the kid has insecurities or like is constantly looking to the parent to answer for them. Like that's an opportunity to call that out. Tell me, so yeah, definitely they're actively engaged. And I with them because they're that child's co-regulator. Like they are, at some levels still their nervous system. So we need them there and we need them to be a part of the process. So yeah, they are here doing the
Yeah,
thing.
I had a I had like a tricky case a couple years ago, and this was the one that I think started to inch me closer to bringing parents more into, or like just thinking about what parents' roles can be in the sessions. And it started out where mom and dad were never married. They were separate, had different households, and they had a kid together. And kid was mom had like left that relationship because of some intimate partner violence, and so she in her mind, dad is the bad guy. Dad is the bad guy. He should not have any parenting time.
Yeah.
And I struggled with that case mainly because I felt like whenever kid had a lot of separation anxiety, so it was totally understandable that mom wanted to be in the room, but
Yeah.
mom wasn't necessarily wanting to like be a part of the session. She wanted to kind of watch the session, and she also wanted to it always felt like she wanted me to really um put my child protection hat on or something and nudge kid into like disclosures at dad's house or something like that. And so it
Mhm.
was such a tricky case because I felt
Yeah.
like I was just being observed and watched during the session. She didn't really want to have any part in it. And
Maybe used
it,
as a tool also an extraction too.
yes,
Yeah.
yes. And so, and because of the way that like when I first started, I was just really talking with mom. Dad didn't really have much custody. And then I ended up bringing him in for some conversations to kind of essentially not get his side of the story, but try to like get his feedback and hear how things were going at his house. And um that was eye-opening to me to talk to him and just to hear like how things were going. Like I mean, he was very forthcoming about struggles that he was
Mhm.
having with kid,
Mhm.
and I felt like I got so much more insight from him, because from mom it was very much like things are great, she does so well here,
Yes.
and because again, like I was always like, oh my word, am I about to get a subpoena in this case?
Mhm.
Um but in this particular one, I felt like it it opened my eyes in some ways to the importance of, number one, involving both parents
Yes.
in sessions, and number two,
Mhm.
trying to have more regular conversations to hear what the struggles are and hear what's actually happening at home, and so that I can be addressing some of those things in session. But that was a hard one just because of the parent dynamics. But
Mhm.
tell me more about like how you would approach cases where you feel like the parents don't want to be involved. They don't want to
Mhm.
participate in session, and
Yeah.
maybe you want to like drop the kid off and go run and get groceries or something
Yeah.
while you're in
Yeah.
therapy.
Where they want you to wave your magic wand and just fix their kid and like,
True.
bam.
Yes,
What's
exactly.
taking so long? It's been 2 months. Yeah.
Right,
Oh,
right.
Those, yeah, absolutely, absolutely difficult. Um, and I think they bring up a lot of stuff in us as therapists. So I think it's really important to recognize that, whether it be anxiety as a new therapist or someone who's been practicing for years, like they can evoke. And so that importance of like recognizing first, like if you just see them on your schedule and you're like, oh, if it isn't at least a neutral, if not a pleasant, one would hope in this role, we get to make those choices who we work with, that there's something there. And so being curious about your own response to them. And I think one of the best pieces of advice that I got from a phenomenal supervisor that I had when I was a baby therapist was to lean into attachment therapy, right? So, like, just like with those angsty teenagers who are crabby and don't want to talk, like, you check in on their boo boos. If you notice a scratch, oh my gosh, what happened? Or, like, are you hungry today? Like, you feed them, you check on their boo boos, you make sure they're not tired, you do all the things at a level that doesn't come off as creepy, right? But same thing with the parents, too. So, if you've got those parents who are like angry or they want to like list off all of the shit that's happened. I don't know if I can say shit, sorry, edit. Of the stuff that's happened over the last week since you saw them. Those are the parents that need a parent only session. Number one, absolutely. You want to go over some of those ground rules that you
Yeah.
might establish for yourself as therapist. But using attachment, like either in those sessions or when preferably the child isn't there, you can, give them like that must have been really rough. So, you are providing therapy to the caregiver. You are because they need nurturing too. Because ultimately, at the end of the day, we know that all behavior has meaning. Everything that a kid or a parent does is there's a reason. We might not know it ever, but like there's a reason. And so it's our job to be curious. And so I feel like showing them that they matter, that you can relate to or empathize with at the very least. And whether it's in the lobby or in your office, um, doing some of that attachment work too. Like, well, what was that like? Being curious. Like as a parent, we all know no matter what the situation, like people don't check in on us, right? As if your kids are healthy and they're doing and you're healthy, like as long as everything's okay, we don't get that nurturance. And so even though they're here to deal with their kids' behaviors, like that's a hard space for them too. And so trying to even the nastiest of parents, like be empathetic. There's a reason they wouldn't choose to be that way. I do not believe if they had it right. Like they're feeling something. And so leaning into it, easier said than done. I know, but
But such a good reminder, like such a good reminder. And just thinking about how for some parents, like I think that we as therapists joke sometimes about like, oh, you put your kid in therapy when you should have gone to therapy. But
absolutely.
like I if they're not in therapy, then this is an opportunity for them to sit down with you and have conversations about how they're doing, how to be uh the best parent for their own kid.
Yeah. Yeah. And every kid is different too. Like, and I would say majority of our parents have more than one kid too. And so that, yeah, like what's their experience not only with this, is
Yeah.
there others? And that's that whole, like you had mentioned too, like getting that perspective from both parents. There's a whole, this could go 2 hours, but
Right.
we have like, what is your experience as a parent to this other child? Like, is
Yeah.
it good? Is that also a struggle we know nothing about? And that's taking a lot of your bandwidth that you can't handle these, what seem like minor issues. Like that matters. That's environmental. And the kid might not talk to you about it in session. But the parent sure will if given the opportunity. So, yeah.
Talk to me about what do you think the difference is between kind of like pulling parent to, well, actually, let me take a step back. When you're
Mhm.
working with kids, you're talking about how you have like parents in session. What about teenagers or like adolescents? What does parent involvement look like for that age group?
So I still for DAs, when it's at least that once a year, absolutely they're in here for at least a small portion of the session. Treatment plans too. Because even I know we all our feels around treatment plans, but it's an opportunity. That's what I look at. It's an opportunity twice a year to connect with kiddo and parents to get like their perspective of how things have been going. Here's where we were at, DAs too, like where are we at now? What's working, what's not. So for sure, up to teens, all the way up. But I think even if they can't come in, right? Because as teens get older and can drive, and parents have gotten able to, or have been able to, um, been relieved of some of those duties, like it's okay to call them in too. But even if they can't, a phone call, like maybe doing a Zoom meeting or something to connect with them. Um, if there's big struggles, let's say, overall well-being, safety concerns, yeah, for sure. I'm calling them, and or they might come in for a session. If it's something that comes up in a session, I most certainly am going to make space before the end of the week to get parent in there, if not parent alone, parent and kiddo in there to kind of problem solve and review safety plan and whatnot. So there's still active involvement. It's just, it's less because also part of the kid's job at that point in time is to develop independence and to separate from parents. And so oftentimes they don't want them there. Um, but in some cases, like it still matters. It's still important. It's still relevant. Sometimes I'll have parents ask, the overly maybe engaged parents, which that can be just as challenging, I would say, as some of the ornery parents, the overly involved ones who want to know and do and fix and help, and which is great. But also, so managing that as well. Totally lost my train of thought.
No, that makes
Breaking
sense.
those, yeah, still matters, still connection with those parents, the helicopter parents. Maybe I would do parent only sessions and talk about maybe we don't need to track them in at Life 60 at 2 o'clock in the morning. Maybe we don't need, right? So those
Mm,
same thing again. It all boils down to connection, relationship, and communication.
yeah.
Yeah.
Can you tell me a little bit about what's the difference? Is there a difference between kind of like pulling parents in for check-ins and kind of had this more parent coaching role, or like trying to, you know,
Mhm.
give them more feedback, more advice, or like
Mhm.
what does that look like?
So, and I guess I'm not totally sure if you're talking in terms of like, is it a different like parent coaching as like, this is, I'm working with this human to just do, or if you're talking about your client who's a minor.
Still like your client as a minor. I mean, um, I know that you've talked about like the importance of parent coaching and like
Mhm.
doing this in how, I guess maybe I just don't even understand how you do it or how that what this
No,
looks like for you.
it's making, yeah, sorry.
No, it's okay.
So I think the difference is parent check-ins are regular, they're routine, they're just a part of the process of therapy with a minor or a kiddo. Um, And so same thing with all the way up to, 17, even 18-year-olds, right? They're still living at home. Those parents are going to come in for treatment planning and our DAs for at least a hot moment in time, or I'm going to check in at least quarterly, a few times a year. I'm going to check in with them some way, somehow. But parent coaching to me comes when it's very, very apparent that there's something occurring within the home, within the parenting that's impacting this child's ability to make progress, right? Or it's making it so much harder for them. Um, and so that's when the parent coaching comes in. And that's when that's more that I really want almost a schedule with that parent where if, even if I'm seeing the kiddo every single week, maybe, I see the parent every other week on a different day. So it's kiddo still, their therapy isn't impacted. I still might do check-ins with the parent when the kiddo's there, but I also want those standalone sessions with the parent to work through kind of their ghosts in the nursery, right? So all of the stuff that happened to them as a kid that impacts, or an adult, that impacts who they are and how they show up for their kid. And gently help them recognize and realize what has occurred to them as a pattern that they maybe are replaying as a parent with their child. And so there's even some screeners that I would do a CPP. It's the life stressor checklist where we go through from their in utero experience all the way through now, and they identify, it's long and it can take like 3 to 4 sessions, but identifies all the things that occurred and what age, and then how they were parented, what felt good, what didn't feel good, right? And so then we can kind of use their words, their experiences in, do you think that maybe when your kiddo says or does this thing and this evokes this response, and you do think there's any way that's connected to maybe when I remember you told me that when you were a kid, all this, right? And so then that it's kind of like this, yeah, you're putting these out, sometimes directly addressing, but other times
Yeah.
it's like putting the idea out there for them to start to contemplate their reactions and their responses. And that helps them regulate themselves. In turn, they can support their kiddo better, right? Kiddo
Yeah.
regulate themselves better. So yeah.
Hmm. Logistical question.
Mhm.
We are an insurance practice. So how do you best bill parent sessions or even just like when you're having lengthy check-ins with parents?
Yeah. So when, and I don't know if this is right or wrong, so compliance will probably tell me this, but if it's just a check-in, like those, the kiddos or the parents that are with us throughout the entire session, that is, I don't know the number, but it's psychotherapy with child present.
I think that's 90847, right? Like family
Mhm.
psychotherapy with
Yeah. It's the one
patient present.
with
Okay.
and present. It doesn't say kiddo. And then the ones where I have them come in, say standalone appointment, just those kind of check-ins for DA treatment
Hmm.
plan or and the kid isn't here, then those are the ones without child present.
Okay. Okay.
And I the same is true. That's the same code that I would use for when I'm doing those parent coaching
Hmm. That
because
makes sense.
intent is solely focused
Yes.
ultimately on the child, even though we're
Mhm.
working on the caregiver, like that we are working on the caregiver for the child. So I code that without child present.
That makes sense. Yeah.
Mhm.
No, that makes
Yeah.
perfect sense. I think I was curious too if you would be billing that as like an individual session with the parent, but I think the way that you're saying makes a lot more sense.
Yeah, yeah,
Mm.
and even when the parents come in at the end of session, even if it's 10, 15 minutes, I feel like I still would bill that 90837, for an individual session for the kid because that's
Yeah.
that minimal
Yes,
in
that
time
makes sense.
with the
Hmm.
grown-up caregiver. It's only if it's the majority of the session that I would do
Yeah.
the family code. Yeah.
Okay, what about if and we've all had parents that are like this where parents call you and want to have lengthy conversations just kind of maybe out of the blue or
Yeah.
um can we bill for these? How would you, if it's like, let's say this parent calls you and has a 35-minute conversation, would you bill
Yeah.
for that?
I
I'm not
wouldn't,
testing
but
you. I'm just,
I wouldn't, but I'm not saying that you
Mhm.
shouldn't. Because I don't necessarily know. If it were their social worker calling me and they were on MA and I wrote it
Yeah.
as their care coordination, then I would. But
Yeah.
otherwise, not in general, but also I will say again, I in my personal practice, um, have pretty strong boundaries or I'm really clear. There's a lot of clarity around
Hmm.
what I'm here for, what my job is, what your job
Yep.
is, and our expectations of one another.
Hmm.
Well, for sure. And those, it does happen for sure. But those are usually like safety related. Like it's an
Sure.
big impactful something, someone
Hmm.
died, or they're indicating, there's big issues at school.
Yeah.
If possible, I try to schedule them for their own session. And then I do the
That's
without.
exactly what I was wondering. Okay, that makes a lot of sense. Then you're redirecting and saying, I don't have time for a super long conversation right now, but I'd love to get you on the sessions or on the schedule so we can
Yeah.
talk through all of
Yeah.
this. And really, I can devote a lot of time to this conversation.
Yeah.
I
Because
think that's a good
oftentimes
boundary.
you'll find when it's an emergency, which there are
Mhm.
emergencies, but oftentimes it's that the caregiver needs their own therapy session, which we can do. We can do, but not on the fly. I need to know what's going on, right? Like, let's schedule this and be very intentional about it because I think that also is an example to them of that intentionality around when something's happening. Let's think about it. What's our plan, right? So I think there's some dual benefit to not just always being available to the parents or any client, right? Like at our expense. So I think that's important too. Yeah.
Okay, I have another question for you. So, if you are working with a parent, let's say two-parent family, married, and you're working with the kid, um, and really like only one of the parents is involved in therapy, not really, maybe maybe the other parent is just like not like not primary parent, doesn't come to
Yeah.
sessions.
Yep.
how much do you push that parent to join things or be a part of things? Like what's the involvement level that you kind of require from secondary parents?
Yeah, yeah. So I am curious about it, right? Like if I notice over the course of time, like they weren't there for the DA intake or DA and they weren't, don't drop off or like someone else is dropping off, picking up. So then I'll just ask like what the work schedule is or if they're around. But then I request, hey, we've got, or if a thing comes up and I want a parent only session, or the one parent does, I will request that the other parent attend as well. I said, well, let's find a time that works for both of you to come in because I do want to hear both perspectives, even though we know based on screeners, when you give two parents the same screener about the same kid, they can be vastly different. Not a problem, or oh my gosh, it's a problem. And it could be somewhere in the middle. So I think it's important. So I ask them, and they might not be able to, and that's fine. But like if it's a continuous thing where there's been several instances, then I will say that it really is important. And I'm hoping that we can just before then, whatever it is, if it's an update or if it's, just a caregiver session, like that we can make this work. And that is where I will wiggle my boundary a bit because I understand, schedules and working families and whatnot. So I'll say like, I'm happy to come in on a Saturday morning or like, 5 o'clock, if that would be helpful. Maybe you and I can meet from 4:30 to 5 and then he can get here or she or whomever. And yeah, so I do push it a little bit, but also that's information for me too, right? Like if I've tried and it doesn't work and it can't happen like that, just in a non-judgmental way, like informs me about some of those family dynamics and
Oh,
relations.
absolutely.
Yeah.
Yeah.
Mhm.
Yeah. Other tips that you would have for clinicians that are working with kids, trying to, involve parents in sessions, maybe are just kind of like me when I first started and feeling intimidated or
Yeah.
feeling, like maybe questioning how, their own experience as a therapist or not being a parent yet, or
Yeah.
what sort of advice would you have for people in those situations?
Yeah. I think reminding yourself that there's a reason that they signed on to do therapy with you, right? Like you're the professional. And so whether you have 10 kids or you've never even babysat a kid, you are a trained professional. You're capable, competent. You wouldn't be here doing this thing if you weren't, right? So for me, it was a lot of that internal like narrative, like boosting, like, I got this. The other piece is kind of tricking your brain too. Like they don't know what we don't know. There can be judgment wafting off of them, but is that our stuff? So there's a lot of like self-as therapists, like, is that my own like insecurities coming up? Maybe they are judging, maybe they're not. But also in that moment is again, I'm the professional. I'm here doing a thing that they can't do or they wouldn't be asking me for help. So a lot of it is that self-talk to remind yourself of what's true. And I still will use at times like they don't know that I don't know, but it's about confidence, right? Like showing up as the professional you are. There's some things you don't know and it's okay to acknowledge that. It's okay to say, you know what, I'm really not sure. I've never had anyone ask me that question. I will get an answer for you. It's okay to not have an answer in the moment. And I feel like it implies and creates more trust with the caregiver that when you can acknowledge that you don't know something but you gotta follow up on it, right? Like, you gotta figure that's out and get back to them, and yeah. But it's hard, it's hard. We all go it doesn't matter how long you've been practicing, I think you still have those moments of like, "Oh, they're totally" whether you feel, embarrassed about it or you get mad about it, it's still there. It's still there, and it's an opportunity for us to grow too as therapists and just recognize it. Mhm.
Okay, I just thought of another question, and this relates to again an old case that I had from a couple years ago. But I was working with a kid was who wanted parent to be in session for the whole time,
Mhm.
but I found that kid was so much more rambunctious, did not listen to me when parent was in session, and so I struggled with that
Yeah,
because I think parent had really good intentions, and I would have loved for parent to be a part of it, but it was I mean, like, kid
yeah,
would when it was just me and kid,
yeah,
they were great. They would listen, they would
yeah,
do the activities, we would have really good conversations, but then the
yeah,
second parent came in, it was like, they are jumping off the wall. And again, like this kind of goes back to my own feelings of like, oh my word, this parent thinks that I just like cannot keep this kid under
Oh,
control.
because they wouldn't have seen all the good work you're doing.
No. And so I'm like telling the parent, listen, this is what I'm seeing.
Yeah.
They're doing really good work, but as soon as you get in the room,
Yeah.
they just get really rambunctious. And so how would you navigate situations like that?
Yeah. Same as you would with, maybe grandpa and grandma, right? Like kids can't, I think all kids are inherently good or want to be good, right? Like they do. But when their safe person comes, just like when grandma and grandpa are like, oh, but they've been good all day long and they'd even done this until you walked in the door. It's not because you're right, bad or doing anything wrong. It's they feel safe to be rambunctious little monkeys, right? So I think sharing that with this well-intended parent who like wants to be there, wants to be engaged, maybe then their engagement can look different. I noticed that they get pretty amped up when you're here and it's a little bit hard for us to even do this. How about, do you want to do a one-on-one session where it's just us? So that's where you can get that buy-in for like caregiver only sessions. And there could be some parenting opportunities there, right? Like if it's amplified in this space and maybe mom doesn't feel secure enough, or dad or caregiver, whomever is their adult, doesn't feel secure enough to like lay down the boundaries, right? Or speak up like they might at home, or is this what home is like all the time? I don't know, right? So all of it is information. And so just gathering that, giving them an opportunity, but those are the parents, yes, you do not want in the room with you. And the parents at a certain point where the kid relies too heavily on the parent, or the parent talks over the kid and won't allow they're taking it for their therapy session, then that's a pretty quick within a session, usually one, maybe two, you can pick up on that and then change gears and then shift and say, I think this might work better if, and so separating them and just having that conversation. You get to
No,
decide.
that makes sense.
Yeah.
Yeah. Well, this has been so good, Jessie. Do you feel like there's anything that we're missing that we didn't touch on?
I mean, I think no, not in general. Like as a therapist, like I feel like I could talk all day about just as a parent too, like the struggles that I think it's that idea of supporting parents in recognizing that how they show up impacts their children. And often the struggles that a kiddo comes in with um, can be, even in the best homes, right? Like related to something a parent is or isn't, could be supported differently. Let me word it that way. By a parent doing something they're not, or not doing something they are, to try to word it gently. And so recognizing that, supporting those parents in learning what they're doing and how to do that differently, regulating self first to support the kiddo, just showing up, being present. I don't know. This is my passion point too. So I feel like I could talk all day. I think we did a really good job hitting some of the really high points, especially for therapists
Good.
that don't work with kids maybe, and
Yeah.
or do work with kids but are afraid of the parents. They're living life the first time through, just like we are too, right? And they've got their own struggles and being curious, I guess.
Absolutely. Awesome. Well, thank you again so much for joining. This has been a great conversation, and I hope people find a lot of value in this. I think they will. I think this is good.
I mean, because we're cool, right?
I think so. I mean,
Of course they will. Well,
Thank you so much to everyone who's listening. Please be sure to subscribe on YouTube, Spotify, Apple, all the different places where you find your podcasts, and we'll see you next week. Thanks.
thank you.